welcome everyone to the Mind Health Shop Talk. We're glad to have you guys today, and we're streaming live now. We're going to give people a few minutes to come in. And I lost my Zoom. Oh, here it is. All right, so welcome. We have Belinda, Benjamin, Carlene, Dr. Willie Barber, Jennifer, Lita. Thank you guys for joining us tonight. Our favorite intern, Shania, or one of my favorite interns. I can't say that anymore because I have a few. Jennifer, Tanya, welcome. Vivian, thank you guys for joining us. And we'll get started in a few. We're just giving everyone a few minutes to jump on. Welcome everyone on Facebook. Get out of some of this. Thank you guys for shouting out in the chat. All right. And so I guess we'll get started because I really am excited about what we're going to be presenting tonight. Welcome everyone to the Mind Health Shop Talk, the Good Health, Great Hair. So Black Mental Health Alliance, we are so pleased to be working with Kaiser Permanente's Good Health, Great Hair, Barbershop and Beauty Salon Outreach Initiative, which brings physical health, mental health, and social health services to West Baltimore communities. And the Mind Health Shop Talk sessions are the mental health component of the program. And these forums are held by licensed mental health clinicians or lived experience and include culturally affirming mental health information, discussions, and resources. So we began in our season in September 2020, and we continue all the way through December 2021. The Mind Health Shop Talk sessions are usually held in awesome barbershops and beauty salons, but due to the COVID-19 pandemic, the programs we're now all virtual, at least until the end of the year, until everything is reassessed again. So tonight's topic is Hope and Healing Through the COVID-19 Pandemic, Part 2. So we did Part 1 we had 3 panelists the last time, and this round we have a dynamic duo couple that I know their story of hope and healing and faith as a huge component will inspire and really just make us feel like there's hope and healing through the pandemic. So for this Mind Health Shop Talk, we hope to share stories of hope and healing through the COVID-19 pandemic and really encourage the mind, body, and spirit. Because really, throughout the Black community, it's been a long practice for us to give space to share and support each other through storytelling. So with all that, I also wanted to talk a little bit on behalf of our executive director about what Black Mental Health Alliance mission is, and then we'll pass it over to Alma Roberts, who will talk to us more about Good Health, Great Hair. But really, our mission at Black Mental Health Alliance is to develop, promote, and sponsor trusted, culturally relevant educational forums, trainings, and referral services that support the health and well-being of Black people and their communities. So that's what we're known for, our trainings and our referral database. So if you need help, if you know someone who needs help, I will drop that in the chat. You can call, text, email to get a referral for a psychiatrist or a therapist. So just a few housekeeping notes. Everyone is muted. You can put your questions in the Q&A section at the bottom of your screen. You should see the menu for that there. And then also the chat, you can put your questions in there, and I'll also be taking questions from Facebook. So I'm going to be quiet for a second and turn the baton over to Ms. Alma Roberts. She is the Interim Director for Community Health for Kaiser Permanente Mid-Atlantic region, and I will send it over to her.
Good evening, everyone. I'm delighted to share this evening with you on such a timely discussion. We are in the continued midst of just an amazing series of events with regard to social justice uprising, the pandemic, the unrelenting pandemic. And this takes a toll on all of our physical and emotional states. Kaiser Permanente has been in the business of embracing physical, mental, and social health for all of its 75 years. We partner with wonderful organizations like the Black Mental Health Alliance to further our work. And in this case, particularly around the mental health of not just our members, but the community, the residents of the communities in which our members live. Our Good Health and Great Hair outreach initiative, as Roxana said, usually all of this takes place in barbershops and beauty salons throughout Baltimore City. We bring our mobile unit and we do address the physical health through screenings of all types. We work with Black Mental Health Alliance on the mental health. We have our Mid-Atlantic Community Network, which is a social support network to support the social needs of our members and the residents of the communities in which they live. Tonight's program is a furtherance of our partnership, as I said, with Black Mental Health Alliance. We are delighted that you are with us. We hope you will continue to tune in as we do these monthly conversations with clinicians, with subject matter experts, as we continue to deal with this COVID pandemic. You will hear more about our expanded partnership with the state of Maryland's Go Vax campaign, and we will be doing vaccine outreach and education across the state. And this Mind Health Shop Talks is one of our major vehicles for getting messaging out that's important to community health and well-being. Thank you all for being with us tonight. Back to you, Roxana.
Thank you. And we're really excited to really give good information out. One thing that you didn't mention is that you had trained all the beauticians, the barbers. So we all got blood pressure training. We all had training about mental health first aid. So the next round was we are COVID specialists. I don't remember what's the name of the title, but we're able to, we were given all the good information so that if someone had questions, we can all respond as well, which is all part of really being good community advocates. So with all that being said, tonight we don't have clinicians that are coming with us, but we have two awesome people that are really life experience, unfortunately, experts in what we're going to talk about. And I was reading their bio earlier, and just this little piece struck me so much that I said that this would be part of your intro. So hopefully you guys are good with it. But before March of 2020, Marcy and her husband, Theirrien Clark, were your typical suburban Maryland, fun-loving, empty nester couple living their life to its fullest. Then in the blink of an eye, life as they know it was drastically changed. During the pandemic, the COVID-19 pandemic, COVID-19 struck their household, forcing them to endure an ultimate test of faith, marriage, finances, and the ultimate test of life itself. Guys, if that sounds like it's dramatic, it's dramatic, but it's real. So both the spouses contracted COVID-19. Can you imagine that? Mr. T spent 46 days isolated for the most part from his wife and family as Johns Hopkins Hospital's worst COVID-19 case at that point in time. And just spending time in the hospital is already bad, but just imagine if you don't have your family with you and just being alone in a valley, in your valley of death. That's just reading this just touched my heart. With 28 of those 46 days in a medically induced coma, it wasn't looking good for Mr. T from a physical and medical standpoint. Marcy used her God-given faith, prayers, and innate talents and previously implemented resources as tools to help navigate her and her husband through one of the most challenging times in their life. And a year later, you're vaccinated, you're healthy, you're whole, and sellers of a best-selling authors of Praying Wife, Healed Husband, How to Survive a Death-Defying COVID-19 Experience. And I mean, I think just even reading about your bio, Marcy, like God was preparing you all this time to be an advocate, because you said that even when you were helping your family navigate through making medical decisions. So we're excited to hear what you have to say. Welcome.
Thank you.
Thanks for having us back. Thank you, Roxana, Miss Andrea, and Miss Alma, and everybody who's participating. Just have to give a special shout out to Miss Alma and her team for their work in the barbershop and the beauty salons, because we know how important our hair salons are, and it's definitely a great resource for us in the Black community to get information. The Black hair salon is actually something that's really special to my heart. I grew up in a hair salon. You would never know, because I don't have a lack of, I have not one bit of hair skills, but I come from a line of hairdressers. My grandmother is a hairdresser and my mother was a hairdresser. So I came up in a salon. So I know that that is definitely a good place for us to be able to fellowship and get good information. So thanks, Miss Alma and your team for that. So we are really excited to be here today. As Miss Roxana said, I am Marcy, and this is my husband, T. I am the praying wife, and T is the
Healed husband.
And we're really glad to share our story today. We have a lot of information to bring to you all. And we want to, kind of keep this, a two-way conversation as well. There will be some time where we'll ask questions. And, we just want to share our experience. We really believe that we went through this experience for a reason, so that we ultimately could, be able to give back and help others through as well. So we are very sharing in our information forthcoming, and we're going to talk about our experience. We're going to tell you our takeaways. We're going to also help you with some of the resources, share with you some of the resources that helped us through. And then in the end, we're going to open it up so that you all can, we can have a discussion. How's that sound? Hope that works for you all. So let me just start out by just asking you all, I just feel like 2020 was just a really trying time for many of us, for me and T, of course, but I'm sure we're not alone. Just by a show of hands or maybe in the chat, on a scale of like 1 to 10, how would you rate 2020 in terms of, experiences? I kind of felt like a lot of us were in battles, whether it was emotional or financial or physical or mental, all the above. How would you all rate your 2020 in a scale of 1 to 10, 10 being, the absolute worst? How would you rate yours? I would say if I had to rate mine, I would probably give it
a 20.
He says 20. I'm going to be positive and say 7 or 8. So we're just going to come back and we're going to talk about that. So as Ms. Roxana said, we are the authors of Praying Wife, Healed Husband, How We Survived the Death-Defying COVID-19 Experience. just to give you all just a little background, these are the loves of my life. This is me with my hat on, which is very symbolic because I wear quite a bit of hats, quite a few hats. This is our 95-year-old grandma baby.
And I'm the handsome gentleman on the left.
And the significance of this picture is this was our first time back together after being split up for months during the COVID pandemic. Grandma lives up in Delaware, where she receives great care, and I'm the overseer from afar. And that was T with his big head in the picture after he had come home from the hospital. So that was our reunion. So that picture is very special. Everybody was healthy and whole.
We're going to actually pivot over to a trailer.
Just a little intro for you to our story.
Praying wife, healed husband will make you laugh, cry, and think. Marcy and her husband T had a life full of travel, fun, family, and friends. They were both affected by COVID early on in the pandemic. Marcy's symptoms were mild. T had flu-like symptoms with a persistent cough. T's doctor instructed Marcy to get him to the ER immediately, stating, "People are dying because they are waiting too long to go to the hospital." Marcy was not allowed in the ER because of her recent diagnosis, so she waited in the car for T's return. 45 minutes later, she received a call from the ER doctor stating that things were worse than they anticipated, and they needed to perform an emergency intubation. T was transferred to Johns Hopkins main hospital the next day, where he spent 46 days total in the hospital and 28 days in the ICU on the ventilator, fighting for his life. On the outside, Marcy chose faith and prayers while assembling a group of prayer warriors to help pray for T's survival. When Marcy chose faith, miracles happened. Find out what happened to T and Marcy in this emotional memoir. Okay, so hopefully you all were able to see that. That was our book trailer and intro.
This is how fiber changed my life. My name is Drew, and I'm the face and hand.
Sorry about that, guys.
Okay. This is a picture of T on the ventilator, 28 days into, I'm sorry, he was on the ventilator for a total of 28 days. This was April 2nd. He went on March 20th. So this was a little less than 2 weeks and probably a little less than midway. As you can see, and one of the reasons why we like to show this picture, although it's very graphic, is because we really want to just show you all a lot of things. The before and now, you see he's here, he's alive and well by God's grace. But we also want to talk about just the importance of utilizing the resources now that we have, that we all have access to, that we did not have early on, including the vaccine, which can keep you from being in this type of situation. I'm just going to start off just a little bit by telling you a little bit of my story, and then T's going to tell you his. This is literally just a little blurb from our book. I'm not going to go through the whole thing. I'm going to kind of paraphrase because it can get kind of long. But I will tell you this. This is from a chapter in our book called The Emergency Room. And this really just talks about my state of mind as I was leaving the house a week after my husband started to contract COVID and started to present with symptoms. We were actually instructed, per the video that you just saw, for him to get to the hospital immediately. And I proceeded to do just that. And this is pretty much what I was thinking as I started to take my husband to the hospital. So we pulled out of the garage, and I just, T just had this look. He was really, you could tell he was scared. He turns to me, he says, "What are they going to do to me?" And him and I both knew, it was a rhetorical question. But, we were both just hoping and praying for the best. So kind of my spirit was telling me that maybe, something was wrong. But at the same time, the faith in me said, you know what, we're just going to pray on this. And I knew that, he was going to be okay. But I know that he was experiencing a lot of physical discomfort. And up until that point, we had a really good life, good health, fortune, a lot of fun. But during this time, along came the sickness. So I knew better than to second guess and say, why God, why us? At that point, there was just a lot of different thoughts going on through my head, as you could imagine, as you see your loved one struggling, with every breath that he takes. And for me, I was really in survival mode. I just really wanted to comfort him because I was physically feeling okay, although I had COVID as well. But I really just wanted him to be okay. So I gave him a tablespoon of cough medicine to suppress his cough. He had a really bad cough. And we were on our way to Johns Hopkins, Howard County. And we arrived to the emergency room in record time, pretty much probably under an hour or so. And T slept very peacefully because I had given him the cough medicine with the codeine that his physician had prescribed earlier that week. And I just, listened to some good spiritual music. That's one of the things that I recommend, that I do, and that I recommend when I'm feeling a little bit of anxiety or when I'm having angst or issues. That's what one of the things that actually calms my spirit. And so I just, listened to my music. I prayed, I rubbed T's leg the entire time, and I really just felt at peace. So when we get to the ER, the great thing was that the doctor had called ahead, T's doctor. And so they were waiting for us at the curb when we got there. And I actually, they wouldn't let me in. So I let him off at the curb. And I watched the lady take his temperature and his vitals. And she told me that he was fine, that his vitals were normal. So I said, okay, great. No drama. We're off to a good start. And I'm thinking, I'm just going to drop him off. He'll probably get, diagnostic test or, some medication, and he'll be back, within a few minutes or an hour or so. So I went and I parked my car and I sat in the car for about 45 minutes and I didn't hear from anybody. So after about 45 minutes, I started to get a little nervous. At that time, I dialed T's cell phone and he put the ER doctor on the phone. He didn't answer, I'm sorry. And then he called me back about 5 minutes later and put the ER doctor on the phone. At that time, the doctor gets on the phone and says to me, yes, things are a lot worse here than we envisioned, and we're going to have to do an emergency intubation. As you can imagine, hearing those words, when I just dropped my husband off, who was sick, but still a healthy person, all types of things started to run through my mind. And I just started to think, Lord, is this the end, the beginning of the end? Am I going to get sicker? Is this the last time that I saw my husband? There were just so many things just kind of just racing through my mind at that time. I had to get it together though. I didn't have time to fall apart. So I just begged the doctor, Dr. Sarkar, said, listen, please let me in to see my husband. I said, I'll wear whatever you need me to. Dr. Sarkar said to me, I can't let you do that because you'll contaminate my whole staff. And those were just words that I'll never forget. It was true, but I'll never forget. So they handed me the phone and I talked to him briefly. I just told him I loved him and I was going to pray for him. He was going to be okay. And that was the beginning of the journey for us. I hadn't seen my husband after that in almost a total of 46 days. They did let us in about 2 weeks later. Because they didn't think he was going to make it through the night. And that's when I was able to get the picture of him on the ventilator that we showed you all early on. His oxygen levels had plummeted to a point where they were talking about end of life measures. And they told me that if he did not respond to their treatment, that there was nothing else that he could do, that they would be able to do. So I just started having, just a number of different feelings, just to sit there in the parking lot, just, trying to get myself together. And all I knew to do was just pray. I prayed, I cried, my brain just felt numb. I just had just a number of emotions. And I'm sharing this with you all for a lot of reasons. I'm being transparent, just letting you know how I felt. And you know what, it's okay to feel like that sometimes. And I also want to let you know, like I said, that it was prayer and faith and, a lot of good spiritual as well as practical and financial resources that actually helped us get through. We're going to share those that information with you all as well. So again, I'm paraphrasing here, but that basically I was in the parking lot and I had just received the news of my life. I had to get myself together, basically call, make some texts to family. For me, I had to start an immediate prayer chain. I felt like my husband was in trouble. There was nothing I physically could do. I couldn't go inside the hospital. The only thing I could do was try to phone a cousin who lived nearby and see if she could possibly go in my place, and she was presumably COVID free. She did come up, thank God, cousin Lawanda, and they did give her some information that they hadn't shared with me previously, and it was just nice just having her there. But I was not able to go inside, and no one was able to be able to CT. So I'm actually going to kind of just pivot through this, but a lot of negative thoughts went through my mind. I was just wondering, was T going to die? Was I going to be a young widow like Vanessa Bryant? I mean, she had just lost Kobe so tragically a month before. And it was just so many just different things going through. And I just said, Lord, please, God, not my boopy. We're just getting started. We just have so much left to do. And one of the things I just want to say is that there's so many unknowns in this world, just a period of uncertainty. And that was definitely one of the biggest periods of uncertainty for me. There's so many unknowns about COVID-19, especially at the beginning stages. But what I did know and what I do know, and I've never doubted, is that my God was in control. And I was believing in faith that he was going to see us through, and you will see that he did.
All righty, we're going to pivot a little bit, and I'm actually going to do the same thing that Marcy did, kind of breeze through a couple of these slides. Wanted to give you, from my perspective, what I was feeling after waking up after 28 days on a ventilator. Now, one of the things that I definitely remember is when I woke up, I was extremely tired and I had a very sore throat. And I didn't realize until a few days later that throat soreness was caused by having the tube down my throat for so long. Okay. So I immediately, looked around. The doctors started asking me a bunch of questions. What's your first name? What's your last name? Date of birth? Do you know where you are? And, I was like, okay, I answered all those questions. But initially, and I guess my body is programmed that way, when I woke up, I said, okay, I really need to go to the bathroom. And I tried to get up to go to the bathroom. And that's when I realized I was paralyzed. I actually experienced atrophy for being on the ventilator for 28 days. So I had no muscle tone whatsoever. So that really freaked me out. I panicked. I started, yelling, hey, what's going on? The doctors come over and says, hey, calm down, Mr. Clark. We're going to physically work to restore you, but your body has been immobilized for over 30 days, and we need to strengthen you so that you can get up and around. Now, I can tell you, I was very nervous. I remember talking to Marcy on the phone, and the only thoughts that could come through my mind was, would I ever be able to walk again? Would I ever be able to provide for my family? And that was so hard for me. I remember there was a nurse named Jenny who was in the ICU. She was very attentive to me, really sweet lady. And because I could not eat or drink, I had a feeding tube. I had tubes coming out of every,
just like the picture.
Yeah, every possible place there was a tube. And I remember asking her, I said, I need to get something to drink. I'm so thirsty. And she said, I'm sorry, Mr. Clark, you can't have any water because your throat muscles are impaired and we do not want you to choke. I was like, oh my God, this is crazy. She said, but I will give you some flavored ice chips. And that is what I survived on for the first couple of days to quench my thirst. I also noticed, because after talking with her, I had a huge facial beard. And if anyone knows me, I do not grow a beard. I'm very clean shaven, but I look like my father times two when I was in that hospital. Laying in that ICU coma for 30 days. So Jenny had mentioned to me, she says, Mr. Clark, you do have a thick beard, but we can cut it for you. So I reached out to my wife and I said, hey, babe, can you bring up my clippers? And I wanted to kind of get a fresh cut. And the hospital informed her, I'm sorry, we're not allowing any outside materials in the room. So Jenny saw that I was bummed and she said, okay, don't worry about it, Mr. Clark. I have some electric clippers at home. I'll bring them in and cut it for you. So the next morning she came in, she cut my hair. Well, she did do something and she gave me a mirror and I was so thankful. And I was like, oh, Jenny, I feel 20 years younger. Thank you. And she said, you know, Mr. Clark, I just have to admit, this was the first time I've cut a man's hair. I said, can I see that mirror again? She gave me the mirror. I said, yeah, I can tell. You kind of jacked me up on this side, but that's okay. I'm grateful either way. So on Friday, April the 24th, I was discharged from the ICU, and basically they moved me to a step-down intermediary step-down COVID unit so that I could begin my physical therapy and try to restore. Now, keep in mind, I was still pretty much immobilized. I couldn't move, and everything had to be done for me, including someone coming in to take me to the bathroom. I mean, it was not a pleasant feeling. So as the days went on, I remember asking one of the nurses, she said to me, she says, hey, have you looked at the menu yet? And I said, no, I've just been eating ice chips lately. She says, well, you need to select what you want for breakfast, lunch, and dinner. Now, I haven't eaten anything in over 30 days. And I forgot to mention, I lost 50 pounds from being on the ventilator. So I looked at this menu, and it was about 4 pages, and I was in heaven. I even called my wife. I said, babe, it's on tonight. They got salmon, they got steak, the turkey, chicken. I'm going to order something good tonight because I really need a great meal. So the nurse came in and she asked me what I selected. I said, I'm going to be easy tonight. I'm going to start with the turkey and gravy and some mixed vegetables. She says, oh, Mr. Clark, great choice. She says, I'll get that order in to you right away. I can tell you guys, I could feel my mouth salivating. It was just so juicy, just expecting to get something to eat. So a couple of hours later, she came in with my plate on a beautiful silver platter. I was so excited. She helped me get up out the bed. They propped me up, and I was like, here it is. It's on. And she lifted the plate, and this is what I saw, if you can see the picture. It was basically a plate full of puree food. So the nurse looked at me and said, is there a problem, Mr. Clark? And I said, yeah, where's my turkey? She says, well, over here is the turkey, and the inside here are the peas, and then you have your mashed potato and gravy over here. And I was like, oh my God. That's when I realized that I was on a restricted diet. Now, they had mentioned that to me early on, but I didn't know what restricted meant. I didn't know restricted meant all mushed together. Oh my God, I found out the hard way. So I tasted it and I tried it, and I was like, this is not for me. I remember calling my wife and I told her, I'm going to lose another 50 pounds because I refuse to eat this stuff any longer. And she was like, babe, you got to eat something so that you can get stronger. I tried, guys, but it was tough. It was really, really tough. So one of the things that, as I mentioned before, the nurse came back and she noticed that I hadn't eaten anything. And she said, are you finished, Mr. Clark? And before she can get it out, I was like, absolutely. And she said, well, you didn't eat much. And I said, yeah, because I wasn't expecting my turkey in that form. She said, I'm sorry, Mr. Clark, but your restricted diet means that you have to, have certain diet restrictions. I was like, because they didn't want me to aspirate. I understand now, but I wasn't happy then. So I asked her, she said to me, can I get you anything else? And I said, yeah, can I get something to drink? Can I get some apple juice or orange juice? Or she says, absolutely. I'll be right back with your thickened apple juice and apple cider or whatever it was. So she comes back in again with 2 cups of orange juice and 1 apple juice. And I took the cup because I was, again, very thirsty. And I tilted my head back and nothing came out. And I was like, what is going on? So I turned the cup back down thinking she brought me empty cups. And I looked in and there was a red substance in there, but it was thickened. And when they say thickened, it's harder than Jell-O. So I had not thought that I was going to have to drink my orange juice and apple juice as Jell-O. Needless to say, that didn't work. And I opted for some additional ice chips, which they were pleased to do for me. Now, you got to keep in mind, they generally only bring you 1 cup of ice chips for the day, but because I hadn't eaten much, they were kind of slacking a little bit and gave me some extra. This particular day, I said, can I get 3 cups of ice? Because I'm not supposed to be able to drink water so that I won't aspirate. But I was so thirsty, I started scheming, I admit it. And they brought in 3 cups. I took 1 of those cups and I hid it up under the bed on the nightstand. And when the nurse came in to retrieve the other 2 cups, she was like, oh, well, somebody must have got it. She left out the next morning ta-da, I had water. Now I knew I was breaking the rules, but I was so thirsty. I would do anything to just get a sip of clean water. Here is a release trailer of my exit from the hospital.
46 days later.
Started back in early March. My stepmom and my dad came back with their COVID positive tests, and we were playing it safe, quarantining, didn't think much of it. One night just went free, and it went from taking him to patient first, and no one was allowed in the building, to next thing we found out he was being intubated, and it's just been a really, really hard time. So it's just amazing to see that he's back. He's better than ever, still has this good sense of humor, and just to see that even though this whole COVID outbreak has been such a Debbie Downer on all of us, we can find a way to kind of shed some light on the positivity that can come out of it.
Last out the hospital. I love you, and I can't wait to see when you get back to the 411 soap again. We're gonna cut up and laugh about this. But I'm just so glad you're home, and I'm thankful for how happens to you. Love you, man. Take care.
So happy that you are home, brother. We wish you so much. And I can't wait till we get together and hug each other like this.
It's been a long road. Lots of prayers went out, and all we can say is glad that he's home, glad that he's out of this place, and thank the hospital, for all that they've done to keep him breath and keep him alive. So we really
Miss Marcy, is it supposed to be a video? We can't see the video. We only hear audio.
We still got a little ways to go, but you're healthy. Keep it up.
If you push share screen and it'll give
Some other
you
things, you might
video and audio, or optimize for video.
I'm glad you're
I
there.
thought that's
I'm
what
glad
we
you're
had
better.
done.
Keep up the good work. Stay
Hold on for a
strong.
second.
You already proved that.
Stop it.
It's been nonstop praying, and it's been nothing but God that has saved him. So we're just
So you're saying I need to do what? It says I'm sharing the screen. You don't see it?
Yeah, we can see the hospital release trailer, but it doesn't, like when you play the video, it just has the audio is playing.
All right, hold on.
But I know when I do share screen, I have to put, yeah, now we can, okay. Now replay it.
Okay, so okay.
Thank you.
started back in early March. My stepmom and my dad came back with their COVID positive tests, and we were playing it safe, quarantining, didn't think much of it. One night just went free, and it went from taking him to patient first, and no one was allowed in the building, to next thing we found out he was being intubated, and it's just been a really, really hard time. So it's just amazing to see that he's back. He's better than ever, still has this good sense of humor, and just to see that even though this whole COVID outbreak has been such a Debbie Downer on all of us, we can find a way to kind of shed some light on the positivity that can come out of it.
at the hospital. I love you. And I can't wait to see you when you get back to the 411 sofa again. We're going to cut up and laugh about this. So I'm just so glad you're home. And I'm thankful for the opportunity. Love you, man. Take care. Happy that you are home, brother. We miss you so much. And I can't wait till we together and hug each other like this. It's been a long road. Lots of prayers went out, and all we can say is glad that you're home, glad that you're out of this place, you know, and thank the hospital, you know, for all that they've done to keep him breath and keep him alive. So we really appreciate all of it. Hey man, I'm glad you made it out. I know we still got a little ways to go, but if you're healthy, keep it up. I'm gonna come over there and see you as soon as you get better. We're gonna talk about them weapons. We're gonna talk about some other things. You know, you might want to pass something over to me to hold. All jokes aside, hey, I'm glad you're better. I'm glad you're getting better. Keep up the good work. Stay strong. You already proved that.
We've been nonstop praying, and it's been nothing but God that has saved them. So we're just gonna keep up that positive energy as well.
All right, can you guys see the screen?
Yes, thank you. I'm so glad you showed the video.
I'm so sorry.
So that video may have looked familiar to some of you. That was our home version of the video, but that footage was actually captured on a couple of the news channels. And actually, I think that's how Roxana and I initially connected, if I'm not mistaken. But it's just amazing. I don't know if you guys could see us while we see our faces while the video was on, but we both still get emotional every time we play it as if it was the first time.
Mhm.
And that was May 6, 2020. So well over a year ago. And we've showed that video 100 times and it still has an effect on us. It's just so bittersweet. That was just a day that nobody expected to happen.
Including the doctors. They had given me a 15% chance of survival.
Yeah.
And we didn't mention this, but I was released one day after our 5th wedding anniversary.
Right. So it was just special. It was just so many different things going on. And like you said, he was so sick and he had developed 108-degree temperature one day. He had like 3 series in a row. And I was just like, oh Lord, please. Like I said, if he does make it through this, he's going to be a vegetable. He's going to be cooked. He's going to have issues. And I was just like, please, I just prayed for him from the top of his head to the soles of his feet, just for complete restoration and preservation. That was my prayer all the way through. And I'm telling you, God answers prayer because my husband, as you can see, is healthy and whole. And it's nothing but God. To God be the glory. Like my daughter alluded to in the picture, in the video. So we just had to say that part. We're gonna get back on track here now. So now, again, we are fast forward now, 16 months, I think, 16 months out of the situation. And, of course, when my husband came home from the hospital, that was the beginning of another chapter, because as you can see, he couldn't walk. That was why they wheeled him out. He had multiple needs. He needed, help with bathing, with dressing. He could feed himself, but, he needed to relearn how to eat regular foods, like he said, from having, the tube from the ventilator down his throat for so long. And so, it was just a long journey to get to where we are today. And so we just want to share with you all now that we're on the other side. We really want to share with you all some things that really, really helped us to get to where we are today. And prayerfully, you'll be able to implement some of these things if you ever get into a crisis. So now it's our goal really to just show others how to have peace of mind in and out of a pandemic, and also to show others how they can actively prepare themselves for the next crisis. So it's all about proper planning and all about, really just being proactive. So the first thing we want to talk about is our spiritual resources. As you can see, faith. Faith is really important, probably now more than ever, just because there are just so many different things that are happening today. There are so many different just sources of uncertainty. And I just feel like, there are times sometimes when you just don't have anything else but your faith. And that's how I felt when I was delivered that news that, my husband was gone on a ventilator and he was in lung failure, and I didn't know when I was going to see him again. So it was nothing but faith combined with prayers that actually helped be able to pull us through. Prayers, meditation. Meditation is really huge. Just sometimes you just have to just go into, I call microwave meditation. That's immediate meditation. You can go anywhere and just kind of just, yourself with God, just one-on-one, just, kind of just get your mind in a good place. For me, journaling is really something that really helps me. It's like conversations with, again, with God, was just being able to just write down my inner thoughts. And I journaled significantly while T was away. And a lot of my journal entries are actually a part of my book. And I did that because I wanted you all, again, to know, just to be very transparent now that we're on the other side, but I wanted you to know honestly about some of the hard days that I had and how I got through those. And then relaxation, relaxation is also very important. And for relaxation, it doesn't have to be anything major, doesn't have to be the spa. You could just simply, for me, I like the sound of water, the sound, and to see water actually is very tranquilizing for me. So it can be a bath. If you have like a fountain or something like that, you might want to just sit by, some water or take a walk in the park, whatever it is, just to get your mind, body, and spiritual resources all together. But some of the practical resources that we really want to hone in on that we discussed in our book as well are personal physician. We talked really briefly about how T's physician opened up the doors for us in the ER. And if you remember, he actually called ahead so they were ready to receive us. And then he was intubated 45 minutes later. So if it wasn't for the fact that we had a relationship with their personal physician, there's a strong possibility that my husband, A, might not have made it to the ER. And B, once he got there, that he may not have, he may have expired before he got, any treatment. So a personal physician is just really important. You want to have somebody you can see at least twice a year for health, for good and for bad, for well visits as well as for sick visits. Health insurance, this is a really big one, especially with this being sponsored by Kaiser. I'm sure Kaiser would really appreciate me talking about the importance of having health insurance. As you all know, our forever president, Barack Obama, fought really hard for everyone to have affordable care, despite whatever income level you're at. And I know that I saw a commercial recently with Kaiser where they actually offer like incentives to fill in the gaps if you're having issues with the financial part. And so again, we want to make sure that we are able to go to the doctor so that we have the insurance coverage that we have to go to the doctor, because that's a huge part of our anxiety as well. We might be feeling sick, but we feel like we can't go, to the hospital because we don't have the resources to go. So health insurance, documents, our living wills, our power of attorneys, and last wills. This is so important. These are things that you want to do proactively. My husband has been athletic all his life. We had no idea that he was going to get sick. None of us could have ever guessed that COVID was going to happen. And I definitely wouldn't have guessed that, we would have gotten sick and that my husband would have got deathly ill so early on in the pandemic. But thank God, when we got married a few years ago, we did have these things in place. So we had our living will. So, when they called me to ask me questions about if he's unable to breathe on his own, do you want to resuscitate him? We had talked about those things. We had those things. I was his power of attorney. I never had any pushback from anybody about making any of his life decisions. And then, of course, you need to have your last wills as well, so that people know, whatever assets you have, even if you don't have any assets, if you have, children, those are assets. Who is going to go, are the children going to go with their father? They're going to go with the paternal grandparents, going to go with the maternal grandparents. Lots of things you need to spell out before it's too late. And then I am also, I will just totally disclose, I am a licensed insurance consultant, licensed life and health insurance consultant. So I can definitely help with these resources as well. but insurance benefits, living insurance benefits. Some of your living insurances are your disability insurances, your long-term care insurances. It's really important to have those things in place because as you saw, again, my husband was disabled. He was unable to work for 6 months, out of work for 6 months. That's, a potential loss of income. What happens when you're out of work that long? We need to have a financial plan. Long-term care, you heard me talk about, him coming home from the hospital in a wheelchair and needing assistance. Well, we have a great family, and our family, as you can see, was very supportive on the outside, but I couldn't allow anyone to come into the house because he was still very vulnerable. And at that time, we didn't have any vaccines or anything. So we needed to make sure that we were able to bring in a healthcare professional to be able to get him the help that he needed and the continuity of care that he got at the hospital. And all those things combined, all the spiritual and practical resources combined, I'm convinced are what led to, him having such a great recovery. And so now, again, that we're on the other side, we want to just help others so that if you all ever get in that situation, that you too will be able to have, a success story. And then lastly, you want to have your death insurances. You definitely need to have your final expense and your burial insurances. This was something that, unfortunately, especially in the Black community, we don't like to talk about, but we're all going to die. We're not immortal, right? So it's just a matter of time. It's not if, it's when. Nobody wants to talk about that, but we really need to make sure that we have plans in place so that if something happens to us, we don't leave a financial burden on our family. We saw way too many GoFundMes and passing the plate and, just a lot of donations and things because there were so many people that died unexpectedly and didn't have a plan in place. And now that we're aware of these things, we know these things can happen. We really, really want to emphasize just the importance of getting those things handled before it's too late. So we're getting here, to the end. We know we've done a lot of talking and we want to hear from you, but we'd be remiss if we didn't talk about the COVID-19 vaccine. So one of the things that we really want to talk about as it relates to the vaccine, I want to talk about first and foremost the fact that when my husband was sick, he was just to really make it, crystal clear to you all how early it was. We got sick early on in March. We were number 4th and 5th in our county. That's how early it was. And at that time, there was no vaccine, obviously. There were no monoclonal antibodies. There was no remdesivir, okay? It was nothing but his body fighting it out, him and God, right? And thank God that we actually won the battle. Now, fast forward, we have resources so that if people do get really sick, or to keep them, first and foremost, to keep them from getting really sick. That's the first thing, proactively, right? And so we want to just make sure that we're utilizing these resources, to keep us from getting sick unnecessarily. So the COVID vaccine is also one of those resources that we like to talk about as well. So we talk about, there's a lot of different controversy and different reasons, for why people feel like, they might not want to get the vaccine. There's pros, there's cons. We just want to share with you just a few things and different reasons why we feel like, you would want to consider the vaccine. Safety, for one. Protection from the variants. I know you all, hopefully you're listening to the news. If not, you definitely want to tune in. There are Delta variants, which are basically a different strain of COVID. It's very, very contagious and it's killing people, okay? This is a lot worse than the original strain that T had that almost killed him. And there are all of the number of deaths and hospitalizations are back on the rise. Here's the crazy thing. The number of deaths and hospitalizations are about 99% attributed to people who are not vaccinated. They are now calling this the pandemic of the unvaccinated. Yep. I mean, come on, go figure, right? So you go back again, 14, 16 months ago when me and T went through this, if we knew what we knew now, and we had the opportunity to vaccinate ourselves, to keep from going through what he went through physically, what I went through mentally, emotionally, and what he went through, emotionally, mentally, all the above, why would we ever subject ourselves to that? We are 608, I think, 1,000 people now dead as a result of COVID. Many of those people didn't have a chance A lot of them didn't even get to the hospital, didn't even make it to the hospital, right? Now we have people an opportunity to be able to take a vaccine that last year many of us would have literally have died for, to be able to have our freedom, right? And and peace of mind. Now we have the vaccine for all different reasons. Some that I agree with, I understand, especially the Black community, the hesitancy because of the history and those kind of things. I do understand, because I was not there initially, but I had to come around because I know that the alternative is sickness or death, and we opted to go with the vaccine. So for a lot of different people, there's different reasons. It might be freedom. It could be, just consideration. I don't want to get my mom sick. I don't want to get my grandmom sick, even if, you don't necessarily want to do it for yourself. Also, it's the right thing to do, because in order for us to reach what we call herd immunity, for, the majority of us to be able to fight COVID, we need to make sure that majority of us are vaccinated. Also, high risk, just by birth, people of color, we are high risk, right? We have diabetes, we have what I call Black people stuff. Yes, high blood pressure, we have high cholesterol, we have a lot of different things. And then to top it off, we also don't have a lot of the resources like we talked about. We don't have physicians, we don't go to the hospital. And for the Black community, when the rest of the world catches a cold, the Black community catches pneumonia. And so it's really just imperative for us to make sure that we take care of ourselves, because when we get hit, we get knocked out. And last but not least, this was one of the things that I actually heard a physician from University of Maryland say that actually turned me around when I was on the fence about the vaccine. She told us it was about 400,000 people at that time, at the end of November, that were actually affected. And she said, basically, if you look like me, and you're Black, you're high risk, she says you literally can't afford to wait. There's 600,000 people now, 600,000. I'm talking to you all now, and 34 million cases and growing. We literally can't afford to wait. For those of you who feel like I just want to wait a little longer, well, if this Delta variant gets a hold of you, there may not be a little longer for you. So again, we really just want to emphasize that we have resources, and we really want you to first and foremost pray on it. Secondly, or whatever order, check with a physician, check with a reputable source, tune into CNN, to ABC, CBS, to your reputable news sources. Not
stay off of social media.
Yes, not social media, y'all. Facebook and Instagram, God bless them. They have their place, they're entertaining, but that is not the source for health information, for credible health information. So please, pick one of these reasons, whatever it is. It may be different for you than it is for me. Say your prayers, talk to your doctor, pick one of these reasons, pick one and get it done. And last but not least, because I know that we're getting there for time. Roxana?
You're good for time.
Okay, I've only got 2 more slides and we're gonna wrap it up. So I challenge you by saying, are you prepared for the unexpected? If not, we definitely can help. Like I disclosed, I am a licensed insurance and real estate consultant, now an author as well. Like I said, I wear many hats.
And a praying wife.
And a praying wife,
Right
yes,
now.
and your healed husband.
Absolutely.
And I can help you with those things: the long-term care insurance, the life insurance piece, health insurance, disability insurance. We even talk about real estate sales and acquisitions as, a way to be able to help prepare yourself, to get ahead and prepare yourself for the next crisis. And we're also available for one-on-one or group presentations as well. So please take a screenshot of this slide
Marcy?
if you're interested.
So everyone can reach out to you for all of these services through info@Praying Wife?
Yes, ma'am. Yes.
Okay.
And they can also call me. So, they can take a screenshot of that. And I think there might be, our social media is on the next page as well.
Okay. And we'll also share that out. Our awesome intern, Shanae, will put all of that into a document, and we'll share that with Kaiser as well.
Wonderful. We really appreciate your attention. We are so glad that you all decided to spend this evening with us. We hope that you'll visit our website and that you'll also go to Facebook and Instagram. We can be reached at Praying Wife Helps. Yes, thank you, Roxana. Little plug there. That is our book. Yes. It's also right there, right to the left of T's head there on our virtual background and Instagram. And we ask that, you follow us because we're doing, some really good things and we're really trying to get the word out to help our folks. If you follow us, we'll be glad to follow you back and just spread the word. Just spread the word about the importance of, just getting your houses, your financial houses in order and just making sure, that we put ourselves in better positions moving forward so that, when things happen to us, we could just, we're all right.
Got that
We're going to be
covered.
okay, right? Got it covered. So thank you all so much. I know I did most of the talking, healed
No,
husband.
you did it all. I'm still healing.
he's doing so great. But I know that I do most of the talking. But at this point, I just say thank you for, your attention. And again, please keep in touch with us. Let me know if I can help you with any of those services. And Roxana, now I'm ready to hear from your people, see what they got to say.
Yes, so thank you so much for sharing so much of your story. And even that video, I think when I was hearing it, I was like, there's got to be a video part to this audio because you could just feel the emotion and just seeing everything together.
Yes.
Oh, that was, and I can only imagine just, so I just wanted to, in the book, oh, you can't see it.
Yeah, because the virtual background
Because
does
of the virtual background. But in the book, you have so many snippets of your text message, of your journaling. Like, was there a formula that you had? Because we at BMHA, we talk a lot about journaling. And a lot of times, sometimes I'll just be like, I'll write little notes, but nowhere nearly as informative as your I mean, you basically documented all of your little information, which gave you a picture that you could look back on. I think even to your emotions, what the doctor said, exactly what the doctor said. How did you do all of that under your duress?
I was a machine during that time. I was just like, in hindsight, I don't know who that person was, but I'm just glad that God gave me that strength. But, really, so I would, again, with me not being there, I would talk to, doctors. I would call or they would be calling me. I would talk to people several times a day. When I first started talking to people, I started with sticky notes, right? So after having a little bit too many of those, and I went to loose leaf paper, right? So I just started writing down things. Before I knew it, literally, when I would talk to the nurse at 12 o'clock, she would tell me his fever and, his position, all those good things that are in the book now. And then I would talk to somebody else at 3 o'clock. And I just started really tracking his progress, really. And on the back end, what I was doing was journaling my own thoughts, again, just and the whole purpose of it really was just to stay sane and organized. Again, just conversations with God. I'm a journaler. I've journaled for a long time. It's just kind of my way of just kind of, getting my feelings out. And, like I said, it's always been very therapeutic. And that was a very stressful time for me. Yeah. And so, and then I had started, the prayer group while he was, under, and I was texting multiple times a day. So a group texting. So while I was talking to the doctors, after I would get off the phone with the doctors, and I would give updates to my prayer group. Then on the back end or my private time, whenever that was, I was journaling. And but I wasn't doing it like planned at all. You know what I mean? It was just really, like I said, just a way of just really staying sane and organized. And so when he actually came home from the hospital and started to recuperate, we had a lot of interest in the story, like you saw, the news cameras and stuff captured his release. And people started to say, you should really, because it was so early on in the pandemic, and he had made such a miraculous recovery. People were just in awe, people were on lockdown. So it's like everything stopped, the music stopped, and they were just looking, to see, is this man going to live? What is going on? It was just like, just amazing just seeing his progress. And so people were just, like, you should put your story in a book. And so, I thought about it. I was like, it's not that far-fetched because I definitely have the content. Now, I'll
Right.
tell you this, I didn't have it all organized like it is in that book. That took some major
No,
work.
because I had to transcribe half of it.
He did.
Trust me.
Everything was in writing, and my writing was terrible because I was writing for me. I wasn't planning to share this
Right.
with anybody. But
What does this dot mean?
yeah,
Right.
I had a binder like, a couple inches thick of just like all his notes, and then my own journal, and then I had a bunch of texts and things. I had to get all that transcribed, and that actually ended up being his job. So, because he was off from work, he was recuperating, it became part of his restoration and therapy. So it ended up being just a really great way for us to, really collaborate as well with the book. So yeah, that's how that all came
around.
together. Yeah, but again, there's nothing but God. I can't say, because in my mind, I was just staying organized. I was just, okay, so I talked to this doctor, he said, so where is he now with it? You know what I mean? Just kind of,
Right.
I'll be talking to different people, nurses, doctors, all the above. I just need to know who I was talking to, what time, and all those kind of things, just to stay organized. Nothing
And
more.
also, I think when you're dealing with a serious illness,
Mhm.
you have to do that so you can stay on top of the doctors to make sure like whatever test results are coming back.
Absolutely.
So I think that's part of what you were saying about being prepared so that you can
Yeah.
know where the plan is for the treatment, and then so you can follow up with it, which sometimes like in the middle of a crisis you're not thinking about that. But I mean, all of us have little post-it notes.
Yes.
Hopefully
Yes.
that's such a good tip, because I didn't even think of you doing that. I just could see you with a notebook, like, I don't know,
Yeah.
typing
And you know
neatly
what?
away.
I didn't think to say this, but I'll tell you this because I'm like the family caregiver, right? But one of the things that I really encourage now, as we speak to caregivers, obviously, as well, different types of groups. One of the things that I really, really encourage is, if you have somebody who's sick, definitely be on the forefront, be involved, like
Yeah.
be proactive, because I know firsthand that people whose families are involved get the best care. I don't care if you're just asking questions, but you have
Right.
to be there. And I couldn't physically be there, but they knew I was there.
And I knew
Right.
too, because every shift, the nurse or the doctor would come in. We just got off the phone with your wife. We got to a point where they came in. I said, so what did Marcy say?
They all
That's
knew.
awesome though that they
Yeah.
gave you that update and you felt more
Yeah.
connected to her, because it's like you're in such a dark place of
Yeah.
being by yourself with people you don't know.
Yeah.
And how
Johns
funny is
Hopkins,
that
wow.
he said he remembered the nurse that gave him ice.
Yes.
Oh, yeah.
He has jokes. He has a
Oh,
lot of
yeah.
jokes.
I'll never forget her. She was my lifesaver.
Yeah.
Oh, that's awesome. What a nice, a beautiful tribute, because a lot of times you're going day to day. And I
Mhm.
think this is for us all to be mindful of those little things that we do for people and we take for granted, like, oh, well, it doesn't matter. I just did this. And look at how that touched you and you still remember it now.
Oh, yeah.
Yeah. And we tried to give back, and we tried to, again, because again, I was writing down names. Now I didn't know which nurse gave him the ice chips and all that.
I knew.
But I definitely, he remembered that part, but I definitely knew, which ones were really attentive and different things, because I would talk to people the same ones, several times a day. And so, Hopkins was just awesome.
They were
They
phenomenal.
rock big time. Because even though I wasn't able to see him, they still tried to keep us, on Zoom after he
Yeah.
came out of the medically induced coma. They would have us on Zoom and stuff. But before he was, when he was under, they would even put him on speakerphone sometimes and just put the phone up to his ear. And I would just talk to him, I read scripture to him, and, a lot of just different things. And I'm telling you, that stuff works, people. I'm going to tell you, T will tell you, again, I don't know what we're looking like on time, but a lot of people have asked him questions about his experience when he's been under. People want to know, like, do you remember stuff? Have you heard stuff? And he's got some really amazing stories about that. And the answer is yes.
Yeah, you can definitely hear it.
Oh, wow.
In fact, I repeated verbatim what my daughter was talking with one of the nurses when they came in to see me, because they didn't think I was going to make it. My daughter is in the medical field. She's studying to be a veterinarian. So a lot of the equipment is similar. And I recall vividly her asking about the blood pressure machine, the oxygenation, this tube, that tube. And I remember waking up and seeing her for the first time. And I kept saying, Kaylin, why didn't you come in the room and rub my feet? Because she was having conversations with the nurse saying, my dad is not going to like his legs being ashy like that. You might want to put some lotion on it. So when I woke up, I said, why isn't my daughter coming in here putting lotion on my legs? She knows I don't like this. Yes. And I even repeated the conversation that she had with the nurse. And my daughter was like, you heard that? I said, I definitely heard it.
Yeah.
I was wondering why it was taking you so long to come back in.
Yeah.
And what a powerful testimony, because when people are in comas, you don't think that they're responding or they can hear you or anything. So that's a good lesson for us.
Another conversation. Yeah, we got some really good stories about that. Yeah. Yeah.
So we have one question, and it's about the book. And I think a lot of people would want to know this. Is there any benefit for you if we order from Amazon or compared to prayingwifehelps.com? Or it doesn't matter and you get benefit either way people order?
It doesn't matter if you're ordering as an individual. It doesn't matter either way. If you want to order in bulk for whatever reason, like if there's any groups or whatever, then I would say contact me directly. If it's like any more than 20 or more, then yeah, you can get them from me, and then we can also autograph them and things too. But it doesn't matter if you get it through the website or Amazon. Actually, if you go through the website, it still will be back, redirect you back into Amazon.
Okay, good. Because that I think we would want to support you and make sure that some big company isn't getting most of your profits. So really, I know that would be important to people.
They take a good chunk. That's another story.
That's a great question. And we're also doing our official Barnes and Noble's book signing, local author book signing on August the 14th. At 1:00. Yeah, at Barnes and Noble's in Ellicott City on Longgate Parkway by Target.
So we will share that out because I'm sure a lot of people will want to go out and support that as well.
Yeah, and you can get the book then and we can actually autograph it for you. Maybe even take pictures.
Yes. So I have my autograph in my book.
Yes. Well, you pre-order before the book came out. And so, these special people, we definitely got you guys autograph. I sent it to you directly myself.
Yes. So I don't see any other questions. One of the things I know that we had talked about just when we were getting ready for this presentation is building up your faith as part of your planning. What were some of the things that you looking back now, like that you were doing maybe in those months leading up to T getting sick, you getting sick, that you could pull from your well of faith to like encourage you in those times of down times? What were some of the things that you come to mind that you could probably put in your toolkit to help that resiliency?
I would say, like over the last few years, like in hindsight too, it's funny you asked me this, like going back now, I really feel like God was really, really preparing me for this time. And I just really got into, like Bible class. I would do like women's Bible class, and we would just really hone in and do, a lot of different exercises and scriptures, on faith and things like that. And so really, Bible reading, Bible study, scriptures, daily readings. Like I read a daily word, just, affirmations, just kind of getting your head right in a good space. All those kind of things truly help just in general, you know what I mean? But it definitely helped to build that faith. I kind of feel like it's like a deposit. You're kind of building up your account so that, when you need it, you can withdraw, and I really stress the importance of proactive faith because, people say, well, what is faith and those kind of things? It's really important for you to know what faith is before and prayers before you need them.
Right.
So you want to proactively work on building those things so that, you will have them when you need them. You don't want to be in a bind and then be trying to learn how, to pray and faith and those kind of things. So those are, again, some of the things that proactively you want to try to implement now.
And just like I had personal relationships with my doctor, she has a personal relationship with her pastor. We go to a mega church in Baltimore, and
We have a personal relationship.
I said, I'm sorry, we. And he reached out to her several times during this,
Yes.
during my trial, and to comfort her. He actually mentioned us in a lot of his sermons.
Yes.
So he was proactively involved as well. So she had a lot of support system.
Yeah.
And I
Before,
think even looking at some of the text messages, just seeing the little I
Emojis.
guess the little memes that you guys would send each other. And I think sometimes we think of like texting people or doing things like that are silly, but I mean, just looking at that, it's like, oh my gosh, it's funny how to wear a mask. But that's something that I think we could just be more supportive to people, just
Yeah.
sending them a funny meme or a little text in their time of trial where they may not be able to talk really long on the phone and stuff. So I think just being a support to people, and the best way we know how, not necessarily how someone else is doing it, but just little things that you could do to help people keep their faith, keep a positive outlook, or maybe listen to them. And you had a lot of that too, listen to the trials that they're going through and just sit there in it with them.
Absolutely.
yeah. Yeah, good friends, good family support, good church folks, all the above. Got to have some folks, some praying folks.
Yeah.
You got to have some praying folks in your life. Definitely.
So
We had folks that we didn't even know could praying.
With that, I wanted to see if anyone had any questions. I don't see any in the chat, but do you guys have any closing remarks that you want to leave out within everyone?
Get vaccinated, get vaccinated, get vaccinated.
Yeah.
You do not want to go through anything of what I went through, not even a partial of it. It is an experience I will never forget.
Yeah. Yeah, I think that's our takeaway too. And then now, I would even say, to add that, I would even say, and keep those masks handy as well,
Keep wearing them.
Yeah, because it's just so many just unknowns. Even with the vaccines, we're not sure how long they last, the efficacy. There's still a lot of question marks. I still believe with all my heart that you're better off with it than without. But still, you still just want to protect yourself, and then we're on this honor system now. You don't know if the person next to you is vaccinated. You may be vaccinated, but again, you just don't know. We don't know what these variants are doing. And so I think between the two of us, our biggest takeaway is really just, vaccines, masks, just, be careful for yourself, as well as for, your neighbor, your family members, consideration. I think we just need, a dose of love now. This is in consideration. That's just something right now that just seems to be just, hard and harder to come by. And really, again, I can't overemphasize just the importance of proactive preparation and planning. And I do another talk that's just basically just about plan and preparing, and pray, plan, prosper. Yeah, that's gonna be the next book.
we may have to bring you back just for that, because I just think of how it could be even contentious when I can just imagine you guys as healthy people trying to make a plan of disability stuff, death plan. Like, why are you planning for me to die right now when that's not the
you
point?
read my mind when we first got done. I was like, wait a minute, she's setting me up here. How much insurance you got? Huh?
But look at how it helped you on the back end.
And I tell you, there was one policy in particular, the long-term care policy that my job offered. I fought her tooth and nail. I was like, Marcy, that is so expensive. I'm not going to be sick. I'm very healthy.
I don't need that.
I don't need it. And I'm gonna tell you, that was a lifesaver, because that was a policy that helped sustain me when I was out for, actually it was 9 months.
As soon as he came out, soon as he came to, he said, what about that long-term care plan? I said, what about that long-term care plan?
We didn't cancel that, right? We still
right. That one, yeah. And some of those things, can be expensive, but there's different ways around it. You can definitely, I can talk to you about that. There's some ways of combining things, like you can get life insurance policies that are affordable, that give you long-term care benefits or critical illness, similar type of benefits. So,
right.
that's always a concern, that, Okay, well, different income levels. So we can definitely help out everybody. These are things that the rich have had for a long time, but they're no longer secrets of just the rich anymore. A lot of us can benefit from these things as well. And a lot of us are doing better than we've ever been doing as well. That's another thing. We're not all struggling, right? And so, we can talk to those who are doing well, who want to do better with their resources, and we can talk to those who are not doing so well and see if we can get them on the right track to prospering and doing a lot better.
Yes, so definitely I want to circle back with, I will circle back with you about that. So we have 2 comments in the chat. My intern, Shania, she said, your story is so inspiring. Thank you so much for sharing. Miss Tanya said, amen. Thank you for sharing your testimony. So I think definitely a powerful testimony. And we're so glad that you were able to share it with us. And just in wrapping up, we will have another Mind Health Shop Talk. We're not taking a break this season, because we just know with all of the extra stress, like Alma Roberts was saying, with the pandemic, with a lot of racial uprising, we didn't want to take a break. The anxiety of people having to go back to school and back to work. So we wanted to make sure we were giving some kind of content to help people with their resiliency. So guess what, guys? The next Mind Health Shop Talk is going to be work-life balance after COVID-19, because really after 16 months of seeing a lot of heavy loss, changes, we really need to operate differently. Hopefully not operate at mass capacity, stressed out, not taking care of our bodies. So we're going to look at that next month. It's going to be August 17th. Same every third Tuesday, 6:00 p.m. I will leave the link in the chat, and we will send out a follow-up email. I'm so blessed now that I have Shania. She's able to help me keep on track with all of this stuff. So I'm able to get the emails out a little bit quicker. So we'll send out the video. We'll send out the faith, prayers, meditation, journaling, some of those planning documents that Mr. and Mrs. Clark had talked about. And then also when we close the survey, there will be a survey link that'll pop up. If you enjoyed our speakers, please give them big remarks so that Kaiser will have them back. And also that helps us figure out what you learned from this presentation. Is there something else that you guys would want? Because really we want to make sure that we're good advocates for our community. So thank you, Mr. and Mrs. Clark. It was awesome listening to your story. Just reading your bio earlier helped me turn around my upside down attitude. So I thank you guys.
Thank you.
Thank you, Roxanne.
And please, guys, make sure you fill out the survey. Have a good night, everyone.
You too.
Bye.
Bye-bye.